enterprises as well. And Raman, would you like to complete your thoughts?
Yeah, so what I was trying to talk about was we need to understand what the issues are in the specific markets, and they're not the same. Access in a blanket terms is ensuring that every patient gets healthcare, but the issues are quite specific to the market. And to overlay that, I think government plays a big role because they are the ones who lay the policies. So China, for example, has gone in the route of universal health coverage. So the private insurance in China is quite limited because the government wants to provide health insurance, health coverage to every single Chinese. Vis-a-vis, you take the case of India, where there's a shortage of 1 million nurses, 600,000 doctors are in short in India. And most of the healthcare is through out of pocket. So I think we need to ensure that the public-private partnership, whether through a social enterprise or completely public, keeps in mind that these nuances, what the government policies are, plus what their remit and mandate is, and adapt versus saying one size fits all.
I'd like to touch on your question about inclusive business because the Asian Development Bank works on inclusive business. We have an inclusive business program, and it is very interesting to see that when you give advisory services on how companies can improve their inclusiveness, they're very open to it. If you have a development story and you have a good business model, companies are very open to change the way they would foresee their business model to grow in the future. So what I want to say is it's important that we create these platforms where inclusive business can exchange their models, their thoughts, find funders, and grow their business models. And of course, you need governments to create the environment. But what we see is, for example, government of Pakistan or government of some countries in the Greater Mekong sub-region like Myanmar and Vietnam, they're very interested to create an enabling environment for inclusive businesses. We work with a few companies in India which provide healthcare services, and there we leverage public-private partnerships and government insurance schemes so that health services can be provided for the poor. And again, then the issue is how do you ensure quality? So I think it's happening in Asia. We need more support and more players like the Asian Development Bank to support inclusive business. The other comment I'd like to touch here is how do you create incentives? I've worked in the public sector in the Philippines, in rural areas, and you cannot live off what you earn there as a public health officer. So we really have to change first the conditions under which public servants live there, but also what they earn. Because at the end of the day, I mean, money is important to everybody, also those who work in healthcare, and that's a reform issue that needs to be driven. But I do think that these public-private partnerships are really important to create discrete interventions which could then trigger longer-term reforms, because obviously you can't change the systems overnight, but you can induce these little changes and tell positive development stories. Like, for example, in Cambodia, we were able to address the gap of healthcare through partnerships with NGOs and private sector players so that health services could be provided to broader population groups. And the next step would need to be how do you make sure these providers are certified and provide the quality that patients need.
I think remuneration is a big issue. I think even in countries like China, now they're going through a massive healthcare reform. There was a time when doctors made money out of charging the patients. So the longer they stay in the hospital, the more medications they take, they're incentivized on that, vis-a-vis actually, because the salaries are so low that they don't make enough. So I think fundamentally there needs to be a change in that as well. And that's what China is currently involved in. Massive healthcare reforms are taking place where they're no longer incentivized of doing that, and their remuneration scales are more in terms of the world standards.
Mm-hmm.
I think you probably need to go one step further before that, before you have medical doctors, is to see who actually gets access to medical school. The problem is that in very poor countries, the only people who actually end up in medical school often come from very privileged backgrounds. To some extent, that exists in more developed countries as well. If you have a pool of cadre of students who come from very disadvantaged backgrounds, who finally get this access to go through medical education or nursing education or pharmacy education, these people are far more likely to go back to the communities to work there. So I think you have to also look at how patients are educated. And I think it's even more it's not just the difference between primary care and aesthetic care. We do a lot of work in Myanmar, Mandalay General Hospital in particular, and the doctors from the National University Heart Centre of Singapore go there and we help them do these tertiary and quaternary type procedures of very high-tech, very expensive, I must say. And all the doctors, they want to learn that because actually ultimately that's where the remuneration is. But I think we need to be cautious about that and really focus on actually what's actually more important in these communities is treating the diabetes and prescribing pills for high blood pressure, which will probably have a much bigger impact on these populations.
Okay, how about we take a question?
Hi, my name is Daniel. I'm from the Medical Concierge Group. We facilitate private healthcare management services. I handle clients from Indonesia who choose to come to Singapore for healthcare, primarily because they don't trust the doctors in Indonesia, right? Because they think the doctors want to operate on them or send them for a procedure that they don't really need. But then when they come here, the same thing happens. How is the industry going to change that?
Right, but of course, those who jump on a plane and go to a different country to get treated, you're talking about a small population who can afford it. Here we're talking about a larger population, a wider population that just can't afford it. But to answer that question,
what you're raising is a very important issue. To bring this to the lower income groups, I want to cite a study. It was a study in the ASEAN countries on results of cancer care, and those showed that around, I think it was 2/3 of people who were diagnosed with cancer basically either lost their estates or their savings because they underwent expensive cancer care. And out of those who were treated, 80% died anyway after 2 years. So this shows you this issue of the ethical question: what kind of care should be provided to whom? And often if diagnosis is too late and then still care is suggested to patients who can't afford it, and then they spend their lifetime savings on this. This is not necessarily ethical. And again, there what we need is really good care guidelines and pathways, which need to be enabled by regulations of the public sector. And there, hopefully, if you have pulled mechanisms like insurances, those can be drivers to regulate and ensure that the right care is given. And of course, you can also do patient empowerment. In Indonesia, we have a project where we equip the communities with checklists, and then they have to check if they get the right care at the primary care center, if all the neonatal exams are done, and so on. So this is how you could empower the community to increase accountability at the level between community and provider.
Mm-hmm. I'd like at this point to bring in technology here. We talk about access, talk about affordability. Is it the case that technology will only reach those who can afford it? Sajid?
Not really. So technology, obviously the whole idea of technology is that it has a multiplier effect, and it's not the delta of multiplication is not linear. By that I mean is that when you have a technology which is digital, serving 1 million people and serving 10 million people, the delta is not equally high, right? So that's the whole idea of technology, bringing it to digital.
Could you give me an example? Exactly how? Maybe paint us a picture of how technology reaches the person in a rural, remote village.
So I'll give you an example of what Tenor Health is doing. So one of the services that we offer is someone using a typical mobile phone, not a smartphone, a regular feature phone, and from that phone, a person can actually have a call with a doctor sitting in a central in Dhaka, where they don't have. In villages, they don't have doctors there in most of the cases, so they can actually have a consultation with a doctor. I'll give you another example, which somewhat relates to the point you were making. Is so what we found in many countries is that if you go to a medical school, you'll see that the men-women ratio as a student is women is almost 40%. But when you go to the practice, at least in the practice field, you'll see the women doctors are less than 20%. The reason being a lot of the women, because of different reasons, can't practice. So technology can actually connect these women. And there is a company which is working on that, which actually connects women, so women can actually do consultation from their home. So the point you're making. So I think there are many examples. There are examples of the electronic medical records. So one of the things that we do is whenever a person calls, we actually create an electronic medical record at the back end. And there is one company which actually ensures that the patient owns the record. And as the patient moves from one hospital to another, which is very typical in many markets, and most of the cases this record is paper and usually losses the records. So if it's medical and it's in a phone, actually it moves with the patient, and patient owns the records.
I agree with Sajid. I think the role of technology in this space of healthcare could be exponential. It's not incremental. And there is one company in Singapore actually that has started detailing or consulting through the web. So they have 5 million subscribers. They go to 10 different countries in Southeast Asia. There are 15,000 practitioners, GP, general practitioners, who are enrolled with this company. And you basically pay a fee, which is very nominal as a subscription every month, and you get detailed over the web. And some of this is also paid by, if you have a state that is actually funding healthcare, then the state or the government actually pays for it. So I think the technology has a huge role and a huge opportunity as we move forward, especially in this space.
Okay, thank you. Hold that thought, please. Thank you. I know you have a thought to make, so we'll come back after the break and we'll listen to Susan.